Welcome, my name is Chris, and this is the Solstice podcast, where we talk about small businesses, technology, and of course, web design. If you enjoy the show, make sure to like and subscribe, leave a comment as a sacrifice to the algorithm, and without further ado, here is the show. Welcome, everybody. Today, I have an amazing guest. His name is Dr. Andrey Filimonov. He is here in New Jersey, an ENT specializing in he can explain a little bit better than I can, so I'm going to let him kind of go off and explain a little bit about the stuff that he does, and then we'll kind of continue from there. So why don't you go ahead, Andre?
Yeah, Chris, thank you so much for having me. It's a pleasure talking to you as always, and in this format. Yeah, so my name is Andrey Filimonov. I am a ear, nose, and throat doctor. Specialize within ear, nose, and throat within ENT. I specialize in a field called rhinology, which is basically like the study of the nose. So I essentially see patients with a whole kind of gamut of issues that are all, focused on the nose. So issues with breathing, allergies, snoring, sinus infections, anything that kind of growths or tumors in the sinuses, things like that. That's kind of the primary focus of what I do. Yeah.
Okay, cool. Yeah, I feel like right now is like the allergy season, so I'm sure you're seeing a lot of people for that. Is there anything else that you see a lot of people for? Something that's really common?
Probably chronic sinus issues is very common. That overlapping with people who are having congestion issues. And congestion issues could be something that, they're suffering with it long term, or it could be something that's, sometimes not an issue, but sometimes more of an issue. So especially people who are, have a tendency to be kind of congested, but at the same time also have allergies. So when allergy season, hits, like as you mentioned, right now we're seeing a lot of the tree pollen come up. That's how it kind of happens. Like the most common pollen right now is the tree pollen, and then it goes into grass pollen over the summertime, and then it goes into kind of the pollen from the weeds like ragweed and stuff like that in the fall. So it's kind of, people can be sensitized to different things. But if they're having issues with congestion kind of once in a while, but they also happen to have allergies, they might have, very severe issues with congestion during allergy season. And a lot of times people are seeing me for congestion, and they might have a thing like a deviated septum is very, very common. Most of the time, people are born with a deviated septum, which is kind of that, division between the left and the right nostril. Sometimes they can get a deviated septum from a trauma that they've had. It's common for kids to break their noses or teenagers to break their noses playing sports or something like that. And, that they basically have like a anatomical thing that's going on in their nose that, regardless of anything else going on, they're basically unable to get that airflow through the nose. So that's a very common thing to see outside of allergies. You could have somebody who was a chronic kind of mouth breather, and one of the reasons they're a chronic mouth breather is because they have a deviated septum and, other potential irritation that's going on in the nose. And that's when we do something like a septoplasty where we straighten out the septum, and other kind of surgeries that open up the nose. And then another really common thing, like I mentioned, chronic sinus infections, either people who are basically have this chronic inflammation. Their nose is always inflamed. And we sometimes don't necessarily know what causes that. So that's definitely something that's worthwhile. That's one of the things in my field that everybody's always trying to kind of look into. But then there's also people who get recurrent sinus infections. So they tend to be fine between episodes, but they kind of cycle through this period of like being totally fine and then being super congested and having a lot of pain and drainage from the nose and things like that. And then they go back to totally fine. And those are a little bit of a challenging patient because if you see them during a time that they're totally fine, like their exam will be totally fine, like everything will be totally fine.
Right.
But that's definitely like, I think kind of those things combined were kind of the most common things that I see in my practice. And then things like, growths inside of the nose, there are some benign growths that can happen that are fairly common. And then cancers inside of the nose are pretty rare, and we will see them periodically, but that's a lot less frequent than somebody who's just having like trouble breathing through their nose, a postnasal drip, allergies, something like that.
Yeah, when you're talking about like chronically inflamed or like congestion, like I feel like you're talking about me because I'm definitely one of those people who has like a lot of it's like congestion, I guess, or like stuffiness, which sucks. Have you ever like seen people who use like the nasal tapes?
Hmm.
Because I always feel like that helped me a lot. And then there's like this, and then I've also seen like the mouth tape. People like kind of train themselves to breathe more through their nose rather than through
Yeah,
the
so
mouth.
those are two different things that we can talk about that are definitely interesting. In terms of the tape of on the nose, it basically kind of lifts out the nose a little bit, and there's this portion of the inside of the nose called the nasal valve, and there's like an inner and an outer nasal valve. But long story short, basically the nasal valve is comprised of partially your septum, which is that thing, that division between the left and the right side, and then kind of the upper side contributing factor of the nasal valve, it's a triangle, is the the cartilage that forms the area that you're kind of pointing to where people try to push it out. So if people are having a difficulty getting air through that area, then if you can imagine, pulling up on that cartilage will significantly increase that surface area of that nasal valve. And that's kind of one of the main limitations in how much air is going into your nose. So by opening up
Mm.
that one part of the triangle, you actually can exponentially increase airflow through the nose. So I think it's very beneficial. I sometimes It's a little bit outside of what I do with surgery. Sometimes I will do certain things to affect the nasal valve, but that is a little bit more of what people do when they do rhinoplasties, when they do, nose jobs. There are cosmetic rhinoplasties where you're trying to make somebody look different, but then there's also functional rhinoplasties where you're changing the
Oh
shape of the
wow.
nose, but it's to better the function of the nose. And that's a common situation would be somebody who really broke their nose badly. Their nose is like off to the side and they're having a significant time breathing through their nose. You could potentially do a rhinoplasty to alter the shape of their nose, but the purpose is not really cosmetic. It's really to just restore the function or maximize the function of the nose. And one of the things you would do is, again, augment that nasal valve and give them, just increase the amount of air that's flowing through an area. And I think even even giving a couple of extra degrees of lift can be actually quite exponential in terms of how much airflow is able to get through. And then the thing with the mouth taping, that is something that's definitely become a lot more prevalent. A lot of people are talking about it. There's a book that I'm actually, to be honest with you, in the process of reading right now called Breathe, that was mentioned to be
Yes.
you know what I'm talking about.
Yeah, James Clear.
Yeah, yeah. Have you read it?
Yeah, it changed a lot of things. Yeah, I count it as like one of my top favorite books, actually.
Really? Yeah,
Yeah.
it's a very
Yeah, we can talk about it. It's great.
interesting book. I mean, yeah, you probably have some insights that I don't have just in terms of having read more of the book, but the basic concept is this idea that, as we've evolved over time, we've kind of, for a multitude of reasons, turned from a nose breathing species into more of a mouth breathing species, and how that
Yeah.
mouth breathing, especially chronic mouth breathing, has, essentially horrible downstream effects on a variety of different aspects of your health. I mean, they talk about how they plugged up the nose of monkeys and made it so that certain monkeys couldn't breathe through their nose, and their actual head shape changes over time.
Yeah.
And they found that, like, it basically, it's linked to so many different other things that you wouldn't really even imagine, like some things like sleep apnea. If you're chronically breathing through your mouth, you're going to be more likely to change the shape of your face in such a way that makes, like, the back of your mouth, and as that kind of the windpipe going down, um, makes that area much more likely to collapse. And that is what sleep apnea is, like that area collapsing.
Wow.
Um, I think that
That blew my mind, actually. The fact that you can like change the shape of your face. Like it
yeah,
was something about like how essentially mouth breathing just makes you uglier. It's not even like people use it like as an insult, right? You're like mouth breathing. You're like a mouth breather. But like it's true that, or at least they have like there's like diagrams on it, and it's like you have like a recessed chin, and there's like a droopiness to the face. But people who mouth breathe generally have like a more defined like jaw, and there's more like I don't know definition. And maybe it's like a muscular thing. I'm not really sure.
yeah, yeah.
I'm assuming like it's like something if you mouth breathe, something atrophies over time. I'm assuming that's what happens.
Yeah,
But
it's
it's
it
super
seems it
cool.
completely changes the way that air is traveling into your body. The other thing they mentioned is, people who are doing strenuous exercises, whether they were, forced to just breathe through their nose or forced to mouth breathe. The people who are mouth breathing, actually, their, like, respiratory rate, the amount of breaths they took per minute, increased kind of exponentially as the exercise got more strenuous, versus the people who are only breathing through their nose, they actually notice that the respiratory rate became lower. So it's almost
Wow.
like, instead of taking like these like small gasping quick breaths, you're taking these more deliberate, slow, careful breaths. And like you don't need to breathe faster to get the appropriate additional oxygen that that your body needs, which I think is very fascinating actually, because you would think like, oh man, like your heart rate has doubled because now you're exercising, you're doing cardio. Now I have to double my breathing to get all that oxygen to my muscles. But
Right.
it's actually, you can oxygenate in a what seems to be a more efficient way by breathing through your nose, which I think is kind of fascinating.
Like the thinking is, and I would think this way too. It's like, oh, I can breathe through my nose and through my mouth, and that would give me more oxygen.
Yeah.
But basically, the idea is that that's not really what's happening. And like,
Yeah.
right?
Well, I think ultimately it just depends on how much air is coming into your lungs. And you can only fit like, a breath is fitting a defined amount of air. So I don't think breathing
Right.
through your nose and your mouth simultaneously, I don't think it necessarily increases the amount of air that you're getting, but there's something about the airflow going through the nose that seems to be more efficient.
I have my father-in-law. He does ultra marathons.
Okay,
And one of the things he was talking about was like when you breathe through your mouth, it's like you get dehydrated faster too. So it's like
definitely.
whenever you're doing like strenuous activity, like running is just like jogging. He would always say that like, yeah, he never breathes through his mouth, he says, because you just get dehydrated faster. And he does like over 100, they're like ultra marathons, so they're over 100 miles.
Same.
So yeah, it's crazy, but he knows pretty well from like from experience, like that's like a thing for them, which is interesting.
How old is he, if you don't mind me asking, like
He's
approximately?
60.
And he's still doing this.
Most of the people who do ultra marathons, the young people are in their 40s,
80.
late 30s to 40. Yeah, 80. Dude, there's really old people doing it. Like 60 is like a good age for it. And what he was explaining is like basically it's because it's so much more mental than anything else that the more mature person is more often going to do better. They go for like days without sleeping. Like this race he did recently was 200 kilometers and he didn't sleep for 3 days. He slept maybe like a total of like 2 to 3 hours tops.
You think about, or you hear about people like having like heat stroke or something like that, and maybe, there's something going on that they didn't realize in their bodies that makes them prone to this. But like people who have like a heart attack during a marathon, and you would think, okay, running for, 26 miles in fine. It's like the New York Marathon and it's hot. So, it's a certain temperature. The combination of those two things are like incredibly strenuous on the body, even for somebody who is
Yeah.
absurdly healthy by typical standards. So I would think like, does that just multiply into the ultra marathon, or is it like once you're able to run a certain amount, it's like you're kind of like, you're just able to do it. It's not really a risk anymore of anything.
Oh, there's a good book called Born to Run, and it's this guy. He kind of like he goes in. He's a reporter, and he goes into this tribe of like indigenous Mexican ultra marathon runners, and they just I don't know. They run for like hundreds of miles at a time. Like a normal easy race is like 60 to 80 miles or something like that. And but they go for like a week or something, like 5 days. They'll just go running. And I don't know. I feel like it's something that like because you're not like in a super ultra it's not like you're sprinting, right?
Yeah,
And I
that
guess
makes
if you're getting enough water, you're okay. But I don't know, man, because like what they do, for example, what my father-in-law does, he's actually like running in the mountains.
yeah.
So it's like everything is incline and then decline. Like almost everything, every part of the race is like some sort of incline or decline.
I would think that that would be over the long term rough for like your knees and your like hips and stuff like that. I mean, I don't know. Or do you think it's something that like if you've been doing this for a long enough time, is it like all of that kind of build up and practice
Yeah.
and training you've done in your life, does that protect you from that? Because isn't like wear and tear on the joints is a thing?
I think from what I've seen, well, because I've been doing capoeira for a long time, I was I always paid a lot of attention to my knees and like joints in general. From what I've seen and from my experience and what I've seen from other people is that you can strengthen ligaments. Like they don't have good cartilage, like they don't have good blood flow, but they do get some blood flow. I
Yeah.
guess the idea is that you have like a knee and then you bring a lot of blood flow into the surrounding muscles. And then some of that goes into the joint areas. And so that's what's causing like adaptation, or that's what's allowing you to get adaptation because you're getting nutrients and such.
Yeah.
But I started really developing my knee strength like after I was like 30. I would say like 31 or something like that. And my knees have never felt better. So I think it's the same thing with the ultra marathon runners. Like my father-in-law doesn't complain about his knees. He complains more just that he's like tired and his feet hurt from just the
Yeah.
stomping and
Yeah.
everything. But yeah, it's crazy. I mean, I saw one of the guys running and like literally because he was running for so long, he was like twisted over like this. And apparently that's like a normal thing. I don't know. I'm imagining like weird stuff happens to your body at
Like
like
he's
100
permanently
plus.
twisted over, or just during
No,
the
no, like he's fine. Like that's the weird part. Like it's something neurological is happening where like after 70 miles, I don't know, he just like twists over like this. And he was like running like this. It was wild. I was like, what is he doing? And
Interesting.
yeah, my father-in-law's like, yeah, like he's completely fine, but it's like something that happens when you just run for really long because you're just tired and I don't know what's happening with your body at that point, you know?
Everyone just has like a pretzel shape that they adopt after.
Yeah. Well, dude, it's crazy. Like
That's interesting.
father-in-law again, he was really tired the next day because obviously he didn't sleep. But I would say after 2 days, he was fine. He
Yeah.
was completely back to normal. I would be destroyed for like a week at least.
Why
If it
does
was me.
he, what is the motivation? Because I feel like the motivation kind of changes from somebody who wants to run like a mile a day to 5 miles a day to like training for a marathon, and then training for an ultra marathon. Like the motivation for all of these is on a spectrum, but I feel like it's different. Like somebody who's running a mile a day and what they're thinking about, and what somebody who's running 100 miles a day, like the reasons they're
Yeah.
doing it, it has to be like related, but very different.
I feel like, yeah, they're related for sure because everyone's trying to like, how do you say it? Like, become better in some ways. But I feel like the people who do like the ultra marathons, they kind of push it a little further, but they also have like that iron will.
Yeah.
Like they're just willing to just suffer. And that is for them a better, like, I guess, test or I guess like test of their abilities. Because I don't know. I don't know why else you would do that really. Like, I could enjoy running if it was like for 5 miles, maybe, or even like for 8 miles, like if I was really, really well trained. But I couldn't imagine doing, like, I don't know, not sleeping for 3 days and just like torturing myself. It doesn't sound fun at all. So
Well, this
I
is
don't
like
know.
the
I
whole
can't
like
relate to it.
David. This is the whole like David Goggins mentality, right? It's like
Yeah, yeah, yeah. Just
trying to
beat the
kill
crap out of
yourself.
yourself.
It's like why? His question is why aren't you trying to kill yourself?
Right, exactly. I don't know. For me, there's like no self love in it. It's just like
Yeah,
it's like you're trying to prove something to
yeah, yeah.
someone or yourself. I don't know. I don't get it. Like, but that's not my motivation, I guess.
Yeah.
Yeah. Well, here let's switch it up a little bit. I'm actually interested to hear some stuff. You're talking about like you're reading this book from James Clear. I love that book. I think it's awesome. I feel like it's a really like constructive book and it helped me change a lot of things about how I breathe. But I'm wondering like is there anything else like maybe is there anything else inside the medical field or maybe outside that you're learning right now that you're interested in learning about?
Oh, interesting. I mean, within medicine, as I've kind of mentioned to you, I'm usually just focused on things that are related to the things that I'm, dealing with on a daily basis, which is related to sinuses or nasal stuff and stuff like that. One of the things that I'm interested in that has been kind of studied but kind of not studied is actually, and this relates to the whole mouth breathing thing, is the effects of doing surgery on the nose on sleep apnea, because that's one of those things that, like, as we've kind of discussed, the two areas are linked to each other, but sleep apnea is oftentimes like a multifactorial thing where there's kind of
Right.
collapse happening in multiple areas of the airway. I mean, just very simply, it's like when you go to sleep, Just for anyone who's listening who might not quite realize what sleep apnea is, you're going to sleep and there's this whole kind of relaxation effect that happens on your entire body as you go to sleep, and that kind of causes shifts in the tone of certain muscles. So certain muscles, even if they're not like things you think about as constantly straining or constantly working, there's muscles in or around your mouth and your throat that kind of, as they relax, there's a little bit more give. And then, as you try to inhale through that relaxed muscle area, the muscles kind of collapse due to, this air coming through, and it almost creates a vacuum effect where tissues tend to collapse. And that's one
Yeah.
of the reasons that people snore. But sleep apnea is a little bit of a step above that, where not only are you snoring, you're also periodically, having these episodes or apneic episodes of apnea where you're no longer breathing. And
Hmm.
that usually just results from, a lot of collapse happening at any one given, seconds or couple of seconds. And usually what that triggers is your brain realizes that you're not breathing. It realizes that, oh, I should be receiving oxygen right now, but I'm not. So it almost sends you into this mini fight or flight response where it kind of does a very small blast of, adrenaline essentially and other things, where it kind of just forces you to like wake up and, open up those muscles a little bit and open up your throat and actually take a breath that gets oxygen to where it needs to go. And a lot of the times that like hit of adrenaline, that quick stimulation it happens, I don't want to say subconsciously, but it happens on such a level that you don't realize that you woke up for that couple of seconds and you're essentially in your mind still sleeping. But people who have bad sleep apnea have multiple of these episodes a night, a lot of times multiple times an hour. Like it's
Yeah.
very common for people to have 20, 30, 40, if not more episodes per hour. So that means 40
Wow.
times per hour they woke up for like a few seconds. They got
So that's
that
like
hit of adrenaline.
pretty crappy sleep then.
Yeah, exactly. And that's a lot of the reasons why people with sleep apnea, they'll sleep for 8 hours, but they'll wake up feeling like they haven't slept that long. And that's the reason, because they've really just been up hundreds of times a night without realizing it. That's one
Yeah,
of the,
you mentioned like, yeah, there's multiple facets to this. And I wonder like now that you're reading like the Breathe book, are you thinking about like what kind of I don't want to say like physical therapy, but like manual things that can be done that are non-invasive, like non-surgery? Is that kind of what it's like leading you to think about now?
well, I'm thinking of it from the surgical standpoint because I'm a surgeon. There's like multiple surgeries that can be done for sleep apnea. And usually, I mean, if somebody's diagnosed with sleep apnea, we jump to kind of the first couple of things would be non-surgical things. And they would involve, usually people tend to be overweight and have sleep apnea. Not always. Sometimes you'll have a skinny patient who has sleep apnea, but majority of the time, your BMI, your weight is directly correlated to sleep apnea, or at least a degree of sleep apnea. So the first thing to do would be like develop a healthier lifestyle, lose some weight, and see if that changes anything. And then some of the other things we do is talk about like wearing like some sort of like dental appliance, like some sort of mouth guard type of thing that basically prevents at least some of the collapse from happening. And that might be, especially if your sleep apnea is on the milder side, one or the combination of those two things might be enough to basically bring you out of it. I mean, I think I would encourage anybody who's diagnosed with sleep apnea and try to lose some weight. Like, obviously, it's difficult, but I think people, what they don't realize is like you don't really, other than being tired, you don't really feeling the effects of the sleep apnea. But the thing to think about is like sleep apnea is linked to a lot of really bad conditions, a lot of different comorbidities. And one of the reasons is like you're getting this constant pulsing of adrenaline, and that's not good for your body to be receiving these waves of adrenaline like all
Mm.
night. So one of the things that people, that it's sleep apnea has been linked to is heart disease, and that kind of makes sense. Like your heart is getting stimulated hundreds of times per night, and you're probably in those little periods like
Yeah.
instead of at your baseline sleeping heart rate, you're like bumping up your heart rate like by 10 or 20 beats per minute every like 40 times per hour or something like that. Yeah, just like it's something that like you don't really feel anything. It's like, okay, everyone's kind of walking around tired, everyone's drinking coffee and whatever. It's like you were living, in this society where everybody's, you're kind of expected to just deal with tiredness. So it's very
Yeah.
easy, I think, for people not to deal with it, not think about like what are the side effects of this like happening? Which I think is one of the reasons it's hard to sometimes convince patients to get treatment for it, because like, fine, you're not going to get surgery. One of the things that's recommended is a CPAP machine that you have to sleep with. And what that basically does is it pushes air into your nose, like it basically provides a constant pressure air into your nose and or mouth, depending on the device that you wear. But that kind of stents open the areas that are collapsing. So it pushes air at such a degree that it prevents the muscles from collapsing. But yeah, but like that is a very kind of very efficacious treatment of sleep apnea. But most people do not want to wear a mask for the rest of their life while they're sleeping, or they're not going to be
Yeah.
compliant with it. You know what I mean? So it's just like it like works great, but like I think if you can lose some weight and potentially do other things, that would be that would be definitely something that somebody should try before just committing to having CPAP for the rest of their life.
Yeah, so a healthy lifestyle is probably still the best medicine
Hmm.
for a lot of people. But I wonder, like, for someone who is coming to you or to another physician for help on some of these things, sometimes it can. I always feel like it's very difficult because I haven't had like an internal medicine doctor that I've seen for more than like maybe 1 or 2 years, and I'm wondering, like, how do you think someone can go about figuring out if like they have a good service provider or someone who's gonna make sure to take care of them, who has their best interest in mind? Because I feel like
Yeah.
that like service, like, just feeling comfortable with your physician and knowing that they're gonna take care of you. Like, what are some methods do you think people could use to kind of see if the physician's gonna be right for them in that way?
Yeah, I think it's a multitude of different factors. I mean, you have to find somebody, we tend to connect with people differently, based on who it is that we're speaking to. So I think inherently there's always going to be people that you interact with better, or you mesh with them better, connect with them better than other people, regardless of what else is going on. But I think in terms of just figuring out, whether this is a provider that you can trust, I would always, make sure that the physician that you're seeing is explaining things, in a way that makes sense to you. One of the things that we're taught in medical school, or not, actually, it might not even be explicitly taught, but one of the things I realized in medical school was that people really tend to, we get kind of bogged down in this medical jargon all the time. And we are obviously learning all this medical jargon in medical school. And then we start talking to other physicians, and all the time
Yeah.
we're using medical jargon. So I think it's very important to, when you're speaking to a patient who might not have an understanding of that medical jargon, it's always best to just use plain language, so to speak. Um, and because a lot of the times what I've seen and what I think is kind of common sense is like there's almost like this uh, you know, implicit desire on the patient to kind of agree with what a doctor might be telling you, so, or at least to feel like, to make the doctor feel like you understand what they're saying. So if you're saying a lot of complex medical jargon, a lot of times patients will just be nodding and saying yeah, 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 but they actually have no idea what you're saying.
Right.
And that, I think, just stepping away from that and realizing that that potentially could be happening, and just like kind of making things a little bit more simple. Like, I don't think anybody's ever going to get mad at you for explaining something twice using simple terms. They're not going to be like, whoa, hold up, I really know what you're talking about, you don't need to explain this procedure to me again. Like, most people appreciate being really having a good grasp of what's going on. So I think that that's important. I think somebody who like answers your questions. ENTs in general deal with a lot of the surgeries that we do are very much kind of lifestyle surgeries. They're elective surgeries. They're things that aren't like, oh my God, we need to go to an operating room right now to do this surgery. So, a lot of it's, things like, oh, I am not breathing well, or, oh, my voice is hoarse, or, oh, I'm not hearing as well as I used to, things like that, like things that you kind of, are related to our senses, and things that you kind of take for granted until they become an issue. But I think that, the reason I'm bringing this up is I always find that it's important to kind of make people understand what the different options are, and to make them understand what is the exact recommendation. And if I'm going to be recommending surgery, is this surgery absolutely necessary, or is this surgery an option for you? And so when I talk to people about the example I used before, like fixing their deviated septum, a lot of the times I'll tell them like, listen, you don't need to do this surgery. A lot of it comes down to, how much is this an issue for you?
Right.
How unhappy are you with the medical treatments that we've tried for this? Or is this something that you're constantly thinking about, or is it once in a while thing? And I think patients really appreciate understanding that like something is, it is fully elective, and everybody's kind of a little bit of a different spectrum in terms of some people come in and they're like, please, like my nose, I cannot do this anymore. Please, what are the surgical options? And some people are like, whoa, hold up. Like I never want to have surgery for this ever. And I think
Right.
that, not just having that one approach where you're like, oh, I'm the surgeon, you're coming to me, I'm going to tell you what is surgery and you absolutely need to have this
Right.
surgery. I think that that's like being able to essentially have an open communication with your surgeon, and you find somebody who's like not just pushing you to do surgery because
Mm.
that's what their job is and that's what they do all day. It's like who's actually, makes you feel like they're making a best case judgment based on your specific situation.
That makes a lot of sense. Like you don't want to go to the person who's like, it's like the hammer nail. You don't want to go to the hammer that's just seeing everything in one way.
Yeah.
So that does make a lot of sense. I'm wondering like now that well, coming from like the more engineering realm, there's a lot of talk about like using AI to one strategize on different things and then implement different things, to actually do a lot of work. I'm wondering, like in medicine, I feel like there's a conversation going on, but I don't really understand it. And I'm curious, like, what are people talking about in terms of like the use cases for the different language models, large language models that we have now?
Yeah, it's an interesting question. It's definitely like permeating into everything, including medicine, including everything else that's kind of all around us. I've realized now that like anytime I'm searching anything on Google, it's giving me an AI summary of those Google searches. I used to not do that until, I don't know, 4 months ago, five
Yeah,
months ago. I don't know when that
yeah,
popped up.
yeah. Super recent.
But it's actually like usually like fairly helpful. That actually usually prevents me from like having to click on a website, or at least half the time, which is, I think like kind of interesting. But yeah, in medicine it's very varied in terms of how it's been used. I mean, these kind of like, there's always been this fear that computers or AI or whatever technology is going to replace doctors. And I do think that, maybe in the, relatively long time period, that that's something that is a possibility. But I think right now, or in the, kind of in our lifetimes, I think that it will be used as a kind of tool to augment what people are doing. I don't think, at least not the way I'm seeing it, I don't think it will evolve to the point that it can just act completely independently. And that's completely also outside of the fact of like, would a person be accepting of being treated by somebody who's, not a human being?
Yeah,
But, in terms of just like things like, it also depends on the different fields within medicine. I think when you have something, and this is kind of extreme generalizations, but like depending on what you do as a doctor, for example, if you're a medicine doctor and you are talking to, patients are coming to you, they're telling you their symptoms, and then let's say you're getting an X-ray or EKG or something like that, and you're getting the results from that. And then based on their symptoms, the physical exam and whatever labs you order, you're coming up with a diagnosis. So I think that some sort of, computer AI technology can definitely, be able to take in symptoms, and you put in what the physical exam findings would be in terms of their vitals and something like that, and you kind of show it an X-ray or an EKG, and let's say it's able to either interpret those things or you tell it what the results are. I think that we're probably not too far, or we're probably almost there to have some sort of system that can take all that information together and spit out, okay, what is the most likely diagnosis and what is the most like
right.
optimal treatment based on the literature that exists for that diagnosis. I don't have a quotation for this, but I actually remember seeing that like humans, or human physicians tend to be, you almost like somebody comes into your clinic and they tell you, first couple of symptoms, and you're already starting to think about, well, what could this be? And I think it's been shown that people kind of irrationally hang on to some thought that they had during the initial parts of an evaluation, even when they're presented with information later on that makes it less likely to be the case. So if somebody comes in and you're like, "Oh, I think this might be the diagnosis," even if you're presented with information that actually just like refutes that diagnosis, you are gonna hang on to it longer than you should because there's something in your mind that's
Mm,
kind of telling you like, oh, this is the first thing I thought of, or like this is the one thing that came to my mind when they said this. Like maybe it really still is this. So like a computer is much less likely to do that. It will just, take all of the information that's being given without, it won't be subject to any, kind of all of these like outside influences.
right, right. Like an intuition, the computer won't.
Yeah,
It
yeah. It
won't.
won't
It
be like,
won't really.
even though everything points against this, it's definitely still this. Which I mean, sometimes that is the kind of art of medicine is figuring things out that like it's not the likely thing, but it ends up being the right diagnosis.
Uh-huh.
But yeah, but I guess the point is something like that in terms of that interaction with the patient is very different than like, let's say, a surgeon operating on a patient. I think that we are very, very, very far away from a computer or a robot or some sort of AI thing, which is able to like accurately interpret what it's seeing and accurately account for like the like insane multitude of anatomical variabilities or any sort of variabilities that you might encounter in order to
Right.
like give you that same kind of surgical outcome. And I mean, an even simpler example of this, like people thought radiologists who are doctors who like look at different scans, like CAT scans, X-rays, MRIs, people were talking like 10 years ago that like, oh, radiology is obsolete, like it's going to get taken over by computers like any day, like there's going to
Oh,
be no
really?
jobs for radiologists. And like even now, like 10 years later, that like we're not that close to that at all. And there
Wow.
are certain, language models and the AI kind of things that have been built that are being used to like analyze scans and things like that, but it's always being analyzed by a second party, by a human physician at the end, because they are still like missing quite a lot of things. Like it's easy for it to pick up on patterns, but then like just it's very hard for it to account for like all of the different like variability that exists. And it's
That's
almost like
interesting.
at this level, the human mind might actually be better suited for that than what we have in terms of our technology. And I think eventually that will become the case. But I think right now it's kind of being used to kind of augment everything, augment, the interactions that you might be having with patients, just giving them a little bit more information, things like that. Or, like I said, helping the radiologists and things like that in terms of, kind of proposing what might be the answer somewhere. But I don't
Right.
think that right now we're at the point where I don't think right now we're at the point where it's going to drastically change how we're practicing medicine. At least not yet. At least not in the mainstream of what I've seen.
Okay, that's interesting. Yeah, because the example that you brought up was the one that I was thinking of. Because yeah, you have like image recognition software. Like I'm sure you've seen like this week, it was like everyone is creating like Studio Ghibli like
Yes,
anime
yes, I saw that.
images from like it was like all over Instagram and everything. So yeah, it's interesting that these LLMs are getting better at this stuff. But I wonder what yeah, I wonder like what would have to happen for them to actually because like once you have the technology, you still have to like implement it somehow, and then you have to get it approved. And even if it's approved, it's probably still going to be like a doctor helper thing for a long time until it like replaces anyone.
Yeah, yeah. And yeah, I think that the point I brought up is like in terms of like, okay, fine, let's say we had a robot doctor. I think there's still that like human element to it. Like most people will like, it's like, you have the Tesla that's driving for you. There's still that human element in your head that's like, I drive better than this car, even though you statistically don't. You just don't. But
Right,
there's still
right,
like if the Tesla got into an accident, you would be like, oh, I could have avoided that if I was driving myself.
right. Yeah, that's an interesting idea too.
Yeah.
Yeah.
So
Well,
I
right
think that
now,
what'd you say?
no, what I was gonna say is, yeah, no, you're right. There's like different examples of that, but you're totally right about that. We wouldn't accept it.
I think the only way you convince somebody to have a robot doctor is that you're born into a world where there are robot doctors from when you are young, there are robot doctors. I think that's the only way. You're never going to convince like a 50-year-old to go see a robot doctor. I don't think, at least.
Ah, 50-year-old? No, probably not. Unless they have a horrible experience. What if they could be really nice? They could give them like a really nice outer, form of a
They look
person.
human. Yeah, if they look
Yeah, they
human.
make them look human. Be like
Yeah.
Star Trek. I think the doctor was like a hologram, and it's just like a robot behind it all. Wasn't actually a person.
Yeah, that's true. I guess if you make them look human enough, then people will trust it.
Dude, right now, like imagine you talk to oh God, I know I was seeing something about like people have like boyfriends and girlfriends who I mean, it's just like some AI bot, some chat bot,
They're
and
aware
it's
that this is happening, or
yeah,
this
yeah, yeah, yeah. No, they're completely aware of it, and they're just like, yes, this is.
they
I
just want to
prefer to
like
be with this
continue to talk.
robot than yeah. So I
Yeah,
don't know. Maybe
you
there's
have
a
an
world
AI
where
doctor that you're just chatting with. You're just hanging out with them.
yeah, yeah. Imagine you could be their buddy. It could be your buddy too. Be could do everything. Actually, that'd be crazy because it could be everything kind of. You know, it would be like your
Significant other, your
psychologist.
doctor, your
Yeah,
plumber.
your boyfriend, your plumber. Yeah, just does everything.
That'd be pretty good. Yeah, that might actually work out. Yeah, I
Yeah.
saw something. I mean, this is less like AI and more of just technology based thing, but there was like some concept of like, let's say somebody who's like in a remote place somewhere, like, they're like climbing a mountain and they fall and they break their leg or something like that. And they were basically talking about like having like a robot that can fly out there and is like basically remotely controlled by a surgeon. So like let's say the surgeon can perform
Wow.
surgery on like the mountain or whatever in some like remote village in the middle of nowhere, and they're just like
Wow.
being controlled by that surgeon, but it's just like having that robot that you can work through, which seems kind of cool, seems kind of interesting.
Drone surgeries.
Drone surgeries.
Yeah, that is wild. That's some sci-fi stuff.
Yeah.
I was gonna for like the last question I really wanted to ask you. I wanted to ask like you kind of have gone through a long physician's journey, and I feel like everyone that I know who has become a doctor in some way, they all kind of had a really long journey, either doing like research years or maybe taking a break or maybe studying something else first. And I was wondering, like, if you could go back, knowing what you do now, what do you think would be the way that you would go through that process to either make it maybe less expensive, or to take less time, or to just to have a better quality experience going through the process from to attending?
Yeah, I mean, I took kind of a slightly longer route than others because I went to pharmacy school before I went to medical school. So I did a 6-year program out of high school, and then kind of halfway through that program decided that I wanted to go to medical school. But I made, based on where I was at the program, when I was going to graduate, when I would have theoretically been applying to medical school and starting medical school, I decided that it made the most sense for me to finish out that 6-year program. So I got my doctorate of pharmacy from that. And then I basically applied towards the end of that program so that I could start medical school immediately afterwards. So that obviously added a little bit of time. The PharmD, the doctorate of pharmacy degree, definitely like made medical school easier on a couple of levels because I had a more intimate, better knowledge of drugs than a typical pre-medical student or a first-year medical student has. So anytime, and drugs are kind of like that is the focus of pharmacy school versus in medical school. That is just one of the things you need to be learning. So drugs and pharmaceuticals were just it was usually like a very quick discussion, like very like you'd have like a lecture or two and they'd jam like 100 drugs, into that lecture. And it was like very, very overwhelming to my classmates. But to me,
Yeah.
it wasn't because I knew all the drugs already and I kind of knew what, there's almost like something, one or two things that you need to know about each drug in terms of like, what are they being used for? Like, what's like the main big complication to watch out for using these drugs? So that
Right.
made like
Right.
studying for exams, very, very helpful. And then the other side of it was I had my degree in pharmacy and I was able to work as a pharmacist. I worked as a pharmacy technician before I went into medical school and throughout pharmacy school basically. So I just got a job working as a hospital pharmacist in a place that was not too far from my medical school. So I used to work like every other weekend, something like that. So I think in terms of like, but that obviously added another element that other medical students weren't necessarily like most medical students don't work. So that added something that sounds like it made it harder, but I think I kind of committed to it and I made sure that I was prioritizing my time appropriately. And I think that's kind of the most important thing when you're kind of going through this whole process is just figuring out what you need to do in terms of maximizing each day And, it can be very overwhelming if you're not kind of being productive on a daily basis or being efficient with your time. So I think definitely being able to kind of, making sure that you're studying appropriately, or, creating a schedule that you're following and not just saying, okay, hey, I'm just going to take a couple days off or do whatever. I think knowing the fact that I had to work and, I also wanted to have time to enjoy myself and had take some time off, it made me, focus a lot on kind of prioritizing my time and making sure that I was using my time efficiently, because I knew if I wasn't, then it would cause a lot of problems. So yeah, I think in terms of making things easier, probably, if I hadn't gotten that extra degree on top of it, probably would have, made the whole process shorter. But I think that, regardless of what you do, you just need to make sure you're kind of managing your time appropriately. And then as you get through medical school, you become a resident. And again, the same thing, most residents, and
Yeah.
you're in the training to be a doctor, you are working very long hours. And I think that if you kind of just get bogged down, from that standpoint, it can be very overwhelming. But at the same time, I think if you do, kind of some soul searching and, figure out what's important to you in terms of time management and time, allocation, I think, you can, that'll make you happier in the long.
Yeah. And then for sure, all that you've done, I think that's one of those things that makes you stand out too as an ENT, which I think is awesome. Andre, thank you so much for having this conversation with me. I really enjoyed it, man. I'm glad. I've known you since like middle school
Yeah.
now. So it's like, yeah, you're one of the people that I've known the longest, which is pretty crazy. And that's really
Yes,
awesome.
you're
So
very
thanks for
cool.
being on the podcast. Can you let everyone know how they can get in contact with you if they have any sort of ENT related issues they might need help with?
Yeah, so again, my name, which I think you'll probably provide, is Andrey Filimonov. I am an ear, nose, and throat doctor who's affiliated with Rutgers. So if you search my name and Rutgers, I will come up. The other organization that my practice is affiliated with is the Robert Wood Johnson Barnabas Healthcare System. So in terms of that, in terms of my practice sites, I go to University Hospital in Newark, which is part of kind of the Rutgers health system, and that's where the New Jersey Medical School is. I also go to Livingston to kind of Cooperman Barnabas, which is one of again the Barnabas affiliates, um, to the hospital there. And then I also go to Jersey City Medical Center, which is another Barnabas affiliate. So I'm in all of those places. I think that if people want to reach out to me, they can look up the Rutgers Ear, Nose, and Throat Department, and there's a phone number there. It should be 973-972-2548, just the general department. If they want to reach me directly, they can email me. My email is Andrey, Andrey, F at NJMS, so New Jersey Medical School, NJMS period Rutgers.edu. That's another way to reach me, and I'm happy to always have people reach out to me directly. But yeah, I look forward to hearing from people. I'm always available to help anybody who's, seeking anything in terms of, what I might do or any other aspect of ENT. I'm happy to help them out and point them in the right direction.
Awesome. Thanks a lot, Andre. Take care,
Thank you.
everyone. It's another great episode. Have a great night.